So you are diagnosed with systemic sclerosis. What's next? What's the treatment then for systemic sclerosis? Now, as we speak, there is actually currently no cure for systemic sclerosis, but we do have treatment that is actually based on alleviating the different symptoms of the condition. So we'll try to help patients with the symptoms of systemic sclerosis that they're experiencing. And we also have medication to actually help to limit damage to the internal organs and when the internal organ systems such as your lung or your heart are involved. I think many of you may be familiar when we talk about treatment, we approached it from a non-pharmacological followed by a pharmacological aspect. So the next part of my talk, I will be speaking on the non-pharmacological treatment that are available for systemic sclerosis, followed by the pharmacological treatment. So for non-pharmacological treatment, we can go through each by symptoms that the patients may experience. When we looked at Raynaud's phenomenon, because this is a symptom that is actually commonly experienced by patients with systemic sclerosis, we'll advise them to try to keep their extremities warm. So we'll ask them to don on gloves or socks as necessary, especially when they are in the air-conditioned environment. For our patients who are working in offices, we'll ask them to try to put on gloves when they can, because if you can remember, this condition actually affects patients in their 30s to 50s, and they're in the prime of their life, and many of them are actually in our workforce. For patients who smoke, we would also encourage them to stop smoking, as this would also help with their Raynaud's. When they have dry and irritated skin, we'll ask them to put on regular moisturizer, as the moisture will actually help with the itchiness and the irritation that comes with your dry skin. Exercise is very important as well because it helps to improve joint flexibility as well as cardiovascular health. So if you can remember, if you do not participate in regular moderate exercise, your joints and all that, the flexibility will gradually decrease, and then your mobility will also suffer as a result, and you may have problems going about, simple day-to-day activities. When patients have digestive system involvement, which is also very commonly experienced by our patients, at least up to 90% of them experience digestive system symptoms, we'll ask them to avoid acidic foods because this could actually worsen their reflux problem. We will also encourage them to take smaller and more frequent meals because this would help with the distension and bloating that comes after each big meals. And we'll ask them to have, their meals earlier on, for instance, dinner, to have an earlier dinner rather than late dinner, because we want them to avoid lying down at least 3 hours after meals to help with the reflux problem. And if they really have to lie down, we'll also encourage them to elevate the head of the bed. This again would actually help to reduce the reflux symptoms that a patient may experience. Next, we'll move on to the pharmacological treatment. So pharmacological treatment, they are actually targeted or aim to ease symptoms that is related to the skin, to Raynaud's and ulcers that the patient may develop, to help with their joint problems, as well as internal organ involvement such as digestive, heart, lung, and kidney problems. And what these medications do is that they help to regulate our immune system. So some of the pharmacological treatments that your doctors may discuss with you may include that of antihistamines when the patient have intense itching of the skin. So, despite having, putting on regular moisturizer, they still feel the skin itch very terribly, and sometimes this would actually keep them awake at night. So your doctors may actually prescribe you with antihistamines to help with the skin symptoms. In patients with Raynaud's phenomenon, they may actually be given medications to improve blood flow. For Raynaud's, it's very severe and it actually affects their day-to-day activities. Some of these medications, which patients may be on include that of amlodipine or nifedipine, if you're familiar with this group of drugs. And in patients with skin ulcers, the doctors may also prescribe you with antibiotics to actually reduce the risk of having the ulcer being infected. For patients with stiff and swollen joints, pain relief may be possible with non-steroidal anti-inflammatory drugs, and if this could be taken on a regular or on an as needed basis. For digestive system involvement, you may be prescribed with medications such as the H2 blockers, and this may include drugs known as famotidine, proton pump inhibitors to reduce the production of gastric acid in the stomach, and medicines belonging to this class include that of omeprazole, and prokinetics to help move your bowels a little bit more, such as that of domperidone. So these are some of the drugs that may be prescribed to you when you have digestive system involvement. In patients with internal organ system involvement, your doctors or your specialists may also discuss with you with regards to using immunosuppressive medications to decrease the activity of the immune system, and this way helps to regulate your immune system. So some of these drugs that you may be familiar with include that of Methotrexate. They may be prescribed for skin and joint involvement, mycophenolate mofetil or Celsep, or cyclophosphamide, and this may be used when a patient experienced internal organ involvement such as the lung, heart, kidney involvement.